Good morning, good afternoon, good evening, wherever in the world you may be. Welcome to another talk, another um, chat. And our guest today is Vivian Sisskin. I'm going to just quickly read out an intro about Vivian. She is a clinical professor, um, Emerita at the University of Maryland, and ASHA fellow, and board certified specialist in stuttering, cluttering, and fluency disorders. She created the YouTube channel Open Stutter, a resource for acceptance and change. She directs the Sisskin Stuttering Centre, pioneering avoidance reduction therapy for stuttering, and is also known as ARTS. Um, So just to start off, Vivian, if I can ask you to share just a little bit about yourself, and in your work, how you got involved in stuttering, etc.
Yeah, well, it started a long time ago. This year marks 50 years for me of practicing avoidance reduction therapy for stuttering. It's a long time. I started learning about avoidance reduction therapy from my mentor, Joseph Sheehan, back when I was an undergraduate student at UCLA, and got involved with him and his clinic. And really decided right at that point in time that this is what I wanted to do in my life. And of course, he wanted me to get my PhD in psychology under him because he was a clinical psychologist. But I decided no, I wanted to actually be involved in clinical work. So I went on to become a speech language pathologist. Over the years, I specialized in stuttering, language, autism. Those are my three areas. I like to joke with people that I specialize in the areas where I have a family member. So my husband stutters, and I have a son with autism. And those two areas remain my two clinical interests professionally and also personally. So this is what I've been doing for a really long time. I really appreciate the fact that a lot of people are saying now this new way of looking at stuttering, um, stutter affirming is new. And I have to chuckle a little bit because, yeah, 50 years of doing this during years when behavioral therapies were much more popular. People resisted what I was doing. I was told in a group once, in a small group of people, professionals, somebody literally banged their fist on the table in front of me and said, Vivian, it is not okay to stutter. And I endured a lot of that during the 80s and 90s. And on and on. And here I am today. And it's delight that there are people all over the world who have become interested in stutter affirming therapy, understanding that we can look at more of a social model of disability, that we don't need to fix stuttering, as you mentioned, Hassan, before, that you thought stuttering had to be fixed. Um, and that we can look at both acceptance as change as positive um, uh, goals in one's stuttering journey. So that's me.
Yeah. Okay. I'm not going to ask all the questions myself because there's others who I'm sure will have questions. Does anyone have a question for Vivian? If not at the moment, just say so. And because I have lots of questions, um, just to get things moving on. Does anyone have a
I could actually start with maybe a little general overview of
sure,
what
sure.
avoidance reduction therapy
Mm,
is. So
mm.
then that might spark some questions from
Okay.
people. So avoidance reduction therapy, as I said, it's stutter affirming and it's acceptance based. The idea is that stuttering is neurodevelopmental, it is genetic. There are physiological elements to stuttering. So the idea is that it's okay to stutter. It can be considered a form of neurodiversity. People can be considered neurodivergent if they choose to. Um, and the idea is that I'm going to say it several times here because a lot of people tell me that they've never heard this before. It's okay to stutter. But for some people, stuttering becomes problematic. And when it does become problematic in somebody's life, it's because there's impact. And from my perspective, the impact isn't because you stutter. The impact is because you struggle. And I'll clarify a little bit about what struggle is from my perspective. Struggle is things that are learned reactively to stuttering as you grow from the time you start to stutter. So they're physical behaviors of escape and avoidance. There's physical behaviors of effort to get words out. There is emotional impact related to shame or frustration or embarrassment or lack of agency, fear. And most important for people listening, because people don't realize this about stuttering, but the mental gymnastics that people go through on a daily basis is the impact from stuttering. Should I talk? Should I not talk? If I show my stuttering, what will they think? Will they hire me? Will they date me? Can I join this group? Will people think less of me? Will they think I'm nervous? Will they think I'm weak? And so the socio-emotional impact and the physical impact leads to struggle. And it's the struggle that is the life impact. So when we look at it that way, and we look at what we might do therapeutically, instead of trying to fix the stutter so there's no life impact, because this fluency as opposed to stuttering will always be there if you're a person who stutters at various forms and intensity. What we try to do is get rid of all of the struggle and leave the disfluency. So in essence, we're looking at stuttering as the umbrella term here, and we're looking at struggle versus disfluency, keeping the disfluency, embracing the disfluency, and getting rid of all of the struggle. And if you think about it, what does that look like if we take stuttering and drain out all the struggle? And most often, it's something very easy and forward moving and very comfortable that doesn't have thoughts of what other people are thinking, thoughts of not wanting to feel something. No worry, no anxiety related to stuttering. So that's what our goals are. And we have outcomes for our therapy that are in 5 basic areas. So the areas of outcome include efficiency of communication. In other words, saying things in efficient ways. That would mean you're not backing up or changing words or repeating previous things or circumlocuting all around, right? Efficiency. The next outcome is comfort, that there's not effort in your communication, and there's not effort either in the physical form of your words or emotionally. There's no effort. The third one is confidence, feeling confident as a communicator, confident as a person, feeling free to take space in conversation as a person who stutters. The fourth one is spontaneity, saying what you want when you want without having to rehearse or think or wonder or hold back. And finally, the last one is joy of communication. And that's celebrating who you are authentically with others around you with a stuttered voice. And if you notice, out of all of those 5 outcomes, none of them are fluency related. Fluency is a symbol of what you can be if you didn't stutter. So we don't focus on actual fluency. We focus on communicative outcomes. And if anybody wants to learn a little bit more about my ideas about fluency, I'm happy to go deeper in that area. So that's the overview. That's the overview.
So that's the overview of arts. Would anyone like to ask a follow-up question on that, or make any follow-up comments or remarks on that before we can move on? Okay. Yeah.
Yes,
Paul, you go.
I have a question here. So from what you've said, Vivian, it sounds like by saying it's okay to stutter, what you're really saying is it's okay to produce the primary symptoms of stuttering, but these secondary symptoms are more problematic. Would you
And I've
agree
got a
with
big
that?
smile. I've got a big smile on my face because we can spend a fair amount of time talking about those primary and secondary and behaviors. And I might argue what those might be. So for example, just to be provocative here,
Yeah,
many people believe that primary symptoms of stuttering include part word repetition, prolongation, and silent blocks.
yeah.
I would argue that blocking is a learned behavior. It is not
Okay.
a primary area symptom of stuttering. And I might even go further as I explore more and more about what we're learning about anticipation of stuttering from the recent research out of New York University, that I'm even wondering if prolongation is a primary feature of stuttering. So, for example, imagine having an open mind and thinking that a block can be an effort to go ahead and hold back at the same time. Approach avoidance conflict. I want to talk, but I don't want to talk. So I'm engaging into the word, but I'm fearing stuttering, or I'm trying to fix that moment of stuttering. And therefore, I lock up and my vocal folds do not easily vibrate. And therefore, I have a silent block. And think about the prolongation in the same way, that maybe what we're doing there is holding on to that sound to gain control, to
Mm,
further control the moment of stuttering, because the fear of loss of control is the primary fear in stuttering.
mm,
So I guess I would, like your question, Paul, is a great one because it has us dive into whether those two categories might be binary.
mm. Yeah, yeah. I completely agree there. There been it's a sort of definitional issue, but also understanding what actually prolongations, blocks, repetitions, what is actually going on there. Okay, thank you. That's answered.
I will continue though the actual question. I
Mm,
will, if it is an issue of definition, I'll say that what we're trying to do is remove reactivity,
yes, yes.
whatever that reactivity
Mm,
to stuttering might be. And from my perspective now, as I grow greater understanding as the decades go by, I think that the actual thing that we're reacting to is impending loss of control.
mm. Yeah, yes. Yes, good. Thank you. Okay.
Any other quick, Peter again? I think you're muted. You're no, you're not muted, but we can't hear you, Peter. Um, we can't hear you. Perhaps there's a problem with the microphone, or if you want to unplug and replug. Okay. So just while Peter is fixing his microphone, would anyone else want to step in with a question or a comment for Vivian? Okay. All right. I have a question. Um. So so this whole concept of being afraid of loss of control is the converse of that accepting the loss of control and just letting the stutter come out any way it wants to.
Ideally, if people started out that way, maybe they wouldn't have developed all the escape and avoidance and all the struggle to begin with. But from a therapeutic perspective, it's not realistic. So we can't just turn to our clients and say, let go of all of that control, because there's too much baggage related to that. There's the whole idea of, if I let go of control, my stutter will be bigger than I want it to be. It'll be more obvious than I want it to be. It'll be more struggle than I want it to be. It will give me more shame than my current form of stuttering does. So therapy is aimed at doing it very systematically, with a very structured framework on how to go through it, so that you're moving ahead from step by step, so to speak, and reducing reactivity progressively. And so you might say, yeah, is the idea in the end to stutter openly and joyfully and allow stuttering to be there without control? Of course. But you only see that in the rearview mirror when you're looking back over your progress. You don't aim for that. So that's like saying, I want to be comfortable and I want to be spontaneous and I want to be confident. You can't go directly for those goals any more than you can for other goals in life. Like, I want love, I want happiness, I want fulfillment. You don't just say, tomorrow I will gain love and fulfillment. You do many things that bring you those things as you look back. And so the therapy is based on, and we can talk more about what it's based on if you're interested, but it's based on resolving 3 very specific conflicts in psychology. So it's based on conflict theory, resolving conflicts. And as the client resolves the conflicts, their communication becomes more open, less struggled, and more authentic.
Okay, I was having difficulty unmuting there. Peter, are you back? No, I still can't hear you. If you want, you can type your question in the chat. I know it's not ideal, but if you type it in the chat, I can certainly ask Vivian. Vivian, until then, I've got another question. Could you explain reactivity? My understanding could be wrong. It's if you have a block or a stutter, if you react negatively to it with fear or shame or guilt, is that reactivity? And are we trying to be non-reactive?
Yeah, so reactivity can be anything. It's a very, very general term. So if we are reacting to impending loss of control, let's say we anticipate a moment of stuttering, Van Riper would say you get into what we call a preparatory set, a set on how you stutter. So for many people, the impending loss of control puts somebody in bracing for stuttering mode, where they begin to approach the moment of stuttering as a battle. It's going to hit me. I'm going to fight back. I have to get through it. I need to escape it. And it becomes something to deal with. So at the moment of loss of control, the idea is that you embrace that moment and bring it to you in a mindfulness kind of way. And when you can bring it to you, you don't react to it. You go with it. And so reactivity generally includes things like effort, struggle, physical struggle, as I mentioned before, also feelings of anticipatory shame and anticipatory fear of loss of something, maybe loss of reputation, those kinds of things.
Yeah, okay, that makes sense. The fear of the loss of reputation, etc. And I think this makes the fear bigger than it should be. Maybe just a suggestion for Peter. If it would help, you can WhatsApp me your question and I can ask it. Yeah, is that okay? Yeah, I've got my cell phone here. And does anyone have a question for Vivian? Yes, Tim.
Hi, sorry I'm late. I was actually in acceptance commitment therapy online, so it was stuttering related. Yeah, I just wanted to say I was late. So I heard that one of the goals or values was comfort and no effort, and my brain just hears no effort, and I think, is that effort as in stammering? There's an element of effort for speech. So what is the comfort element? I guess I'm asking.
Yeah. So comfort is the outcome of comfort means that your disfluencies will be drained of tension, any kind of fighting. So in other words, if you're trying to control the moment of stuttering, that ends up with tension as well. So even if we use a strategy, for example, let's say a strategy like a Van Riper pullout, where we're making some effort to get in and out of it a certain way, that adds tension. And so what we want to do is let go of the tension so that it can be comfortable. And so comfort in communication is comfort in your body, comfort in your mind. You're not doing the mental gymnastics and thinking about what other people are thinking and worrying about what you're going to be feeling. Letting your mind be present in communication so that you can communicate joyfully with your communicative partner and not be thinking about what you're going to be saying next or how you're saying it. And then there's also emotional comfort, where the comfort comes from allowing yourself to stutter without worrying about your own feelings of being a poor communicator, or your own feelings of shame related to the moment of stuttering, or guilt related to playing a false role when you're not showing your stuttering. So there are so many emotions that are involved in stuttering. The two big ones that people are aware of are shame for showing it and guilt for not. And so you're sort of bad either way, and that no matter what you do, whether you show it or you don't show it, you're going to feel some negative feelings. And so authenticity also leads to the comfort that we're looking for. We're looking for peace, communicate. We're looking for comfort in the mind, in terms of emotionality, and also physically.
Okay, thank you.
Tim, does that answer the question? Do you have any follow to that, or are you okay? I would just like to say that I can relate completely to the mental gymnastics, which is actually more painful than the actual physical blocks. But so, yeah. So, a question from Peter Lowe. Would you agree with Dr. Martin Schwartz that the vocal fold block is due to bursts of tension generated by the brain?
I don't know that I would agree with much of Dr. Martin Schwartz, I'm just being honest. But for that particular bursts from the brain, I don't know. I mean, I don't know what the brain is actually doing. We've been able to study the brain in terms of looking at function, structure and function related to stuttering. But in terms of whether the burst comes from the brain or not, I don't know. My sense is that blocks come from a person consciously or unconsciously being in a conflict of wanting to say the word and wanting to hide stuttering, and therefore locking up one's vocal folds to the point where you can't say the word. And the reason I say that is because in therapy, we are very successful in reducing blocks. And I think if it were a burst from the brain, I think it would be a much harder thing to do, to be able to restructure whatever's going on in the brain in order to change the block. But blocks in avoidance reduction therapy, we reduce blocks very quickly, basically by reducing that conflict of going ahead and holding back, by approaching the moment, not holding back, and allowing to make noise. And usually the reason the block occurs is the person wants to minimize that moment of stuttering, make it smaller, make it little, make it less obvious in the room, make it less loud to themselves, take up less space with it. So they hold back. And that's when things lock up. Imagine doing the opposite, adding your stuttering out there and reducing the avoidance gradient, so to speak, and approaching that moment of disfluency with confidence. You hear the phonation. The phonation is there. It's part of the disfluency. And so getting rid of the block and allowing stuttering to be open and full of resonance, full of vocalization, is one of the earliest things that we do in therapy. So going back to whether what causes it, I think is, from my perspective anyway, and Peter, I think that being able to change it is more exciting than learning what causes it.
Okay, Peter, I hope that answers the question. Do you have any follow-up comments? If you want to send me. Okay, does anyone have another question? Yes, Leonard.
Just as a follow-up question, that as someone who spent many years with Dr. Schwartz's technique or airflow technique, which I imagine you're probably familiar with, would you then say, perhaps, I've always had kind of a love-hate relationship with the technique, but I practice it and practice it. I practice it for like half of my life, it seems, to varying degrees. My speech has become much better, but I'm not sure whether it's the technique or whether it's a lot of things that you're saying, that I've become more comfortable with stuttering mildly. I was growing up a very severe stutterer, and if my speech ever were to go back to that level, I don't know that I'd be comfortable with it. So there's still in the back of my mind a fear of that. Fortunately, it hasn't happened to that degree, except for a bad day here or there, for a very long time. So I guess my question is technique, any technique such as an airflow technique, counterproductive to that? In effect, we're trying to hide our stuttering by breathing properly, getting the airflow so that we minimize the risk of stuttering. Is that a bad idea? Is it better just get rid of techniques and speak confidently, say what we want to say when we want to say it, regardless?
Yeah, I appreciate that question, Leonard. It's a really good one. And I just want to say that there are many roads to Rome, and many people find their journeys to comfortable stuttering from a variety of different avenues, and there isn't one. And I know people who have done fluency shaping, they've done, operant approaches, they've come up with their own form of stuttering that has brought them to the goals that they achieve. Whether we would have a lovely discussion on whether just exactly what you said, whether all of that practicing and all of the focus on stuttering and people we've met in communities like this, all of those things contribute to being more open and more accepting, and therefore less struggle. So it's hard to know because we can't isolate any one of those things. I will say that in terms of practicing techniques, they do create fluency in many times, not all the time, but many times by suppressing stuttering. And if you practice it and practice it and practice it, you prevent stuttering and are able to get through fluently. The problem is with that, from my perspective, is that when you do stutter, there's nothing you can do about it at that point. It's just a failure. So you haven't learned how to let go of tension. You haven't learned how to embrace that moment. And in terms of changing, the only change you've made is that you figured out ways to not show it and suppress it a little bit. If you practice and you practice and you practice, that can be very successful for people. And I know people who do very well with it. But very often when I'm talking to them spontaneously, they're struggling. And so I say, was therapy helpful? And they go, yeah, very helpful. And I said, well, can you show me? You mean do it? Oh yeah, go ahead and do it. And then they do it, and then they're fluent. They may sound a little robotic, a little bit monotone, but they certainly are able to do it when they want to. There are another set of people, and mostly the people that I work with, who don't want to do that. They want to be who they are all the time. They don't want to have to do something so that they conform to a very narrow definition of normal fluency in the world and society. They want to live authentically as a person who stutters and be spontaneous in their communication. So they don't want to have what we call controlled fluency, where you have to do something to get it. And the value of spontaneity overreaches the value of fluency. And so, again, I'm not trying to say one is better than the other or one is bad. I think there are different perspectives, Leonard, and I think that there would never be a time when I would say that somebody's controlled fluency is something that is not a good thing, especially if it allows them to live the life that they want to live. Like you said, you wouldn't want to go back to your struggle. And I think that one way that we can look at this is there a danger of going back to struggle with one form of therapy or another? And I think that research has shown that certain kinds of therapy are more prone to what they call relapse. We don't use the term much anymore, but going back to old patterns of struggle. While if you are engaged in a therapy program where you reduce struggle and don't work on fluency, those struggled patterns dissolve and they're just not there anymore. You don't go back to them. So if you're looking for long-term results, you might be wanting to do more of a therapy program like arts, where it takes a long time to get there. This is not an easy program. You're changing the way you think about communication. You're allowing yourself to be a disfluent person. You're taking the role of a stutterer rather than the role of a fluent person. And that's actually one of the conflicts that we're resolving. I'm wondering, do you think it would be helpful for me to describe the 3 conflicts inherent in our therapy?
Yes,
Yes,
yes.
please.
Okay. So there are 3 conflicts that our therapy program resolves. And this is the theoretical structure that most of it comes from Joseph Sheehan, although I've added the 3rd conflict. He had the first 2 conflicts. I added the 3rd one because I noticed that I was working over the decades with people. We were working on really 3 of them. The first one is the approach avoidance conflict. And that's the idea that people are in a conflict on whether to speak or not to speak, to participate or not to participate, to say the word or not say the word, to show stuttering or not show stuttering. There's always a conflict and there's always a way out. Word substitution, pretending to think, holding back content, not showing up, using an changing things around, adding words. There's always a way to not approach. And so that's a conflict of communication, conflict between speech and silence. And in order to resolve that, we have to increase that approach drive and reduce the avoidance drive. Because the way it's seen is that there's 2 competing drives. There's an approach drive, which is heading toward the goal. And as you get closer to the goal, your desire to achieve it increases. Like the phone is ringing. As you get closer to the phone, you want to answer it and say hello. At the same time, there's an avoidance drive that kicks in that's steeper, and that avoidance drive says, don't answer it. Okay, so answer it, don't answer it, answer it, don't answer it. And right at the moment when the 2 drives meet is where the person actually oscillates and gets stuck. High. And if it gets really stuck, it could be a block. But showing stuttering, doing the thing that you fear, actually releases the fear and you're able to finish the word. That's the fear reduction hypothesis. The next conflict that we're resolving is what we call a role conflict. And it's a self-presentation role. So we like to say that stuttering isn't really a speech difference. It's a difference in social self-presentation. Now, Sheehan used the word disorder. We don't always use the word disorder, but he would have said that stuttering is a disorder of social self-presentation because it's so variable, and in social contexts is where stuttering actually varies to the extent that we are presenting ourselves as a role of person who stutters or person who's fluent. So there's this idea that you go through the day and you're mostly fluent, let's say, or you're fluent some of the day. And let's say you go and you order your lunch and you're fluent and you say, I'll have a chicken sandwich, and you were fluent. Well, the next day you say, well, I was fluent yesterday when I ordered my chicken sandwich. I'm gonna hope to be fluent again. So you go in with the idea of, I'm going to be fluent again. I'm going to try to be fluent. And what happens, I think all of you know, the more you try to be fluent, the more you stutter, right? So that very moment when you're saying chicken sandwich, that's the moment you're going to struggle. Or your name, here I go again. I said my name fluent yesterday. I'm going to try to say it fluently today. You go to say your name, introduce yourself, you struggle. So the idea is, though, that you're taking on the role of a fluent person when you walk through your day, trying to be fluent, enacting the role of fluent person. And then when you stutter, you have role conflict. You're showing yourself as a person you don't want to show. You're showing yourself as a person who stutters when you truly want to show yourself as a fluent person. Now flip it around. Imagine that you walk through your day with the role of stutterer and you enact that role. So you expect to order the chicken sandwich and stutter, and you give yourself permission to stutter when you order that chicken sandwich. Very often you'll order it very comfortably. So the role of reveal or mask is one that we're also resolving. So we want somebody to take off the mask and enact the role of person who stutters 100% of the time, because that's what they are. And the third one is a conflict of control. So that's the idea of either letting go of suppression or suppressing stuttering. And that's what I like to call a conflict of management. And I think this is what you were talking about, Leonard, when you were talking about strategies, managing the moment of stuttering, managing stuttering. And when I think about it, is management is like controlling something. It's something to be managed. What if we didn't have to manage our talking? We don't have to manage our walking unless we have some kind of issue that needs management. Can we at some point let go of management of talking? And so letting go of control and management and effort related to how we stutter is actually the third conflict. So those are the three things. We want to get into approach mode. We want to take the role of a person who stutters and role enactment to be who we are honestly and authentically, and then let go of control and management so that we can be spontaneous and comfortable in our stuttering. So I hope that helps understand that the therapy has lots and lots of goals and individual assignments and objectives that lead toward resolving these conflicts, and then which then lead to our outcomes.
Thank you, Vivian. Does anyone have a follow-up question to the conflicts? Because I've got a couple of questions from people. Yes, Tim.
Sorry, yeah, I'm with you, a lot of it, I'm with you. But my questions are on, so when you use the example of like the role of a fluent person, so you try to be fluent, and you flipped it and said role of a stutterer. What about the idea of like a self-fulfilling prophecy? Because I found that in my 20s, I was all about being open. I went to stuttering conferences and I kind of defined myself as like being open and stammering. And I did feel like that self-fulfilling prophecy was a thing. And the less now I define myself and I see it as like an immutable trait. So is there a part of the process where you kind of have to let go of the I am a stutterer? Do you know what I mean?
Yeah, I love that. I love that. Yeah. So if you talk to people, I should grab my husband and bring him in because he's been through this journey. But the role of person who stutters in his life is way back there among all the roles. I'm a dad, I'm a husband, I'm an astronomer, I'm, a man, or whatever it is. He has many, many roles that he plays, and one of them is role of stutterer. And it doesn't come to the forefront unless somebody's talking to him about stuttering, and then he'll say, oh yeah, I stutter. But it's not something that is in the forefront. It's part of the fabric of all of who we are. Now, if you try to remove that role from your life, that would be false, because genetically and physiologically, you're a person who stutters. You can pretend it's not there, but it's there. Now, focusing on it a lot can be just as bad as not focusing on it at all. But there's a time in therapy on your journey where, when you're resolving the role conflict, that you have to put it up front and take that role, because of all of the rest of the things you've done in the past to hide it. So if you've been suppressing and concealing and masking for years, you have to go through a period of bringing it out and dealing with it and making friends with it and embracing it. And once it's embraced and understood and part of who you are, it tends to fade in the background. And it's just like fluency. The more you're chasing it, the harder it is to get. And the moment you stop chasing fluency, it's in your lap. So it's a bit like that role of, I want to be someone who doesn't stutter. What I like to say is, you don't have a choice. You can pretend that you're not a person who stutters, but that's not one of the choices you have. You have choices on how to stutter. You have choices on how to relate to your stutter. You have choices on how you present as a person who stutters. But if you've grown as a person who stutters, that's not a choice you have to not be one. So that's what I would say in terms of role. We have to accept what we need to accept, which is a reality, and change what we can. And there's a whole lot to change. I'm a true believer of acceptance and change. I'm not one of those practitioners who thinks that we should accept everything, including the struggle. I am a firm believer that you should not have to accept all of the things you've learned to do during a lifetime of doing things that you learned when you were not accepting yourself as a person who stutters. So if you have physical struggle and blocking, and you are changing words and not participating and cutting yourself off, and all of those things are things you've learned from the time you realized that you were stuttering because of society's stigma and internalized stigma, why should you accept all of that? So to me, accepting the role is not accepting all of that. That can all change. But the essence of role, who you are, doesn't necessarily dictate the severity of stuttering or how it's presented. The people who identify as people who stutter and have let go of all of the things they've learned over their lifetime to avoid it and suppress it have very little overt stuttering.
Great answer. Great answer. Yeah, that was great. Thank you.
Thanks, Tim. I've got a couple of questions. Another one from Peter, and one from one of our members on our WhatsApp group called Daniel. I'll ask Peter's question first. And Peter's question is, it seems to me that many people, if not most, within the stuttering community deny the role of the subconscious mind in stuttering. Would you say that the power of the subconscious can be used to our advantage?
Yeah, I think bringing some of that subconscious, content to the conscious level can be helpful in some cases. So we have, I'll make this part kind of short. We have a number of group therapies, part of the Sisskin Stuttering Center. And one of our groups actually focuses on trauma-informed practices related to stuttering. So people who experience stuttering as a trauma, repeated trauma over their lives, there is a group therapy that does arts, trauma-informed care with arts. And many of the subconscious drives come from trauma. So in other words, repeated trauma of a certain situation of introducing yourself, for example, at that moment of the introduction, you have a fight or flight response that is very much brain-based, and you're not saying, I'm going to avoid. Your body and brain just have you avoiding. So by looking at those kinds of responses and bringing them to more conscious level and being able to make a choice about the response and how you respond to a moment of stuttering can be a helpful thing. The other thing I would say about unconscious is I'd like to just talk a little bit about habit. And so many people will say, yeah, I haven't in my stutter, and this is how I stutter, but I'm not trying to avoid anything. I'm very open and I'm willing to stutter. That might have been learned at, who knows, maybe at a young age, very young age, as an escape behavior, as an avoidance behavior. But it becomes imprinted on the stuttering pattern and becomes part of the stuttering pattern. If you want to change those kinds of patterns, whether it be a head jerk or a tongue protrusion or a block or a retrial is what we call it, or anything that you're doing in response to that moment of stuttering that's not because of avoidance, there is a process of bringing it to conscious level in order to then get rid of it. So I'm addressing that question of unconscious from a number of different ways, that we have enormous amounts of unconscious drives related to stuttering from a lifetime of trying to avoid it. And addressing them is all part of the therapy in terms of the counseling approaches that we use. I know that Paul mentioned, no, it was Tim mentioned that he was at an ACT talk before that. We use a whole variety of behavioral approaches in order to do the counseling for our therapy. So we use ACT, we use CBT, we use mindfulness, we use a whole range of first, second, and third wave of behavioral psychology in order to promote change. And so it's not just the speech therapy. In order to change speech, you have to be willing to risk. And there's a lot of work that we do with our clients related to weighing that risk, when to take that risk, how to evaluate what happens when you risk, and being able to accept the fallout when things don't go the way you want them to. So thanks for that question. That was a good one.
Okay. Peter, hope that answers the question. If you have any follow-up comments, let me know by WhatsApp. Okay, question from Daniel. So I'll just open that. So what Dan is asking is, this is regarding a debilitating fear regarding people, especially strangers. He's saying there are times at work where he needs to do customer service or things in the area of sales and persuasion. These often drive me into a full paralyzing panic attack. I have not stuttered for years now, but the deep fears have not seemed to have changed much, if at all.
Yeah, yeah. And I appreciate that experience. It's an experience of many, and it's exactly the way described, Daniel. So thank you for that. And thank you for your vulnerability in sharing that. Stuttering is all about fear and shame. I mean, if I had to summarize it up, struggle is about fear and shame. It's about fear of judgment and fear of feeling feelings, feeling that fear. It's about being paralyzed, like he expressed, doing things that you're so afraid of the consequences of. The short answer is that as hard as it is at work, and as much as people want to work directly in their most feared situations, that's not the best way to go about it. The best way to go about it is by going into low feared situations and beginning to address the fear in the lowest feared situation where you still feel a little fear. So it might even be at home. If you have fear of stuttering with a family member, if you have fear of stuttering with a store clerk, with a restaurant server, because the whole idea is that we're moving slowly into feared situations and learning adaptive responses that allow us to stay there and stutter without fleeing. In a very high feared situation or a very high stakes situation that Daniel's talking about, all anybody can do is give you advice to get through that moment. That's not therapy. Therapy would be addressing it from a very systematic way, with the idea that you will be working up slowly toward work presentations. And what happens is that the mid-feared situations fall down to low-feared situations. The high-feared situations fall down to mid-feared situations. So it's not that we're addressing these high-feared situations directly, but the work at the lower end has allowed other situations then to fall down. And people will say, a presentation at work used to be something that I would not go to work for. I would drop a class at school if I had to give a presentation. I have clients who say, no, I don't do that. And that's the way it is. If you said you need to do it, you have to face your fear, the damage it would cause in terms of re-traumatization would not be good therapeutically. So we want to start in low feared situations and move up. And in those higher feared situations, it's okay to avoid. And I have a saying, don't be a hero. And you really can't be a hero in those high feared situations. If you want to work well toward your goals, you want to start low. Nobody's going to enter the triathlon tomorrow. They're going to run a half marathon, hopefully first, right? And it's the same kind of thing. You have to work up toward it. So as much as I want to validate Daniel's experience, and it's real, and it's probably the thing that's bothering him the most, because many people describe, I have low fear situations and then I have the high fear situations, nothing in between. And he might be one of those kinds of people. We need to find the ones that are in between, because we don't want to re-traumatize. So hopefully that was satisfactory for Daniel. It doesn't solve his problem at work, but it gives him an idea that he has permission to react to that fear and to not do everything at work until he's ready.
I'm sure that Daniel will find that helpful. Unless anyone has a question, I have a question. Okay, Paul, you go first.
Well, you could ask yours first if you want.
No, yeah. Oh, after you.
Okay. So I'm just wondering, is it possible that avoidance reduction therapy works better in some cultures than in other cultures? And the reason I'm asking this is because I often come across people who live in cultures where there's really very little understanding of stammering. And when I speak to people who stammer from those cultures, I've heard many stories about how if they let people find out that they stammer, that they're likely to be punished or they're likely to be excluded or something like that. And it occurs to me in a situation like that, or in a culture like that, maybe an avoidance reduction approach may only be of limited value. What is your thinking on
Yeah,
that?
I think it's real. I think that there are cultural differences in how people understand stuttering and how they approach it and what they expect therapeutic results to be. So just absolutely, I agree with you 100%. Um, do I have people in my groups from all different cultures all over the world? Yes. Um, there are people who have had enough experience um, with fixing approaches for, curative approaches that have been unsuccessful. And for many, even in the United States, spending lots and lots and lots of money on them and failing. And so many of the people who are in my groups have gotten to the point where they have nothing to lose. In other words, they can only get better. I think that even in the United States, even in Western countries, I have a lot of people from the UK in my stuttering groups, people in Europe in my stuttering groups. I would say that in most cultures that you would say would be more friendly to this kind of therapy, we find family members that are not at all accepting.
Mm.
And so people are putting up with a society that this most of us are living in societies where the stuttering is the last disability that it's still okay to laugh at. And when you think about that, even in our culture, there would be very few other differences and disabilities that anybody would openly laugh at, but stuttering is still one of them. So we have so far to go. The fact that people are finding the therapy even in culture friendly environments, they're still going to be going against a society that would like to see you fixed. And we have a few movements now that are rippling around the world that I hope will change that. Number one is that, and I noticed this because I've been doing this for 50 years, and I've been teaching students this for over 40 years. There's a different sense of social justice among the young people today. They're just resonating with ideas of diversity and inclusion and difference being okay. And that's not just in communication, that's in gender and in race and all kinds of things, culture. We also have an understanding that's come from the autism community. And I have a 38-year-old son with autism, so I've seen a lot of changes in that community, where it was curative when it was a very curative approach when he was young. And now it's a very accepting approach where if we try to change someone with autism because their brain is different, to try to change their brain, it's considered ableism. And people are resonating with that. There's also this notion of pride in being different. And there's a stuttering pride movement. I'm sure you know about it. There's a stuttering pride flag out there. So with the changes that are going on in our society, I have become very, very positive and optimistic that not only things will change in our culture, but in other cultures as well. So I'm not sure if I answered the question, Paul, to your satisfaction. All I can say is that you're right, and I have hope.
Right, thank you. Yes, yes, you've answered to my satisfaction. Thanks. That's helpful.
We'll do another couple of questions. I've got a question for you, Vivian. What was it like to work with Dr. Joseph Sheehan?
He was a funny guy. He was always cracking jokes. And we used to have a clinic at UCLA, and I was an undergraduate, I was a student. I was just like, do this for me, Vivian, do that for me. I would get an assignment over the weekend to do a complete bibliography, of every book in the library. And it's like, I'm up all night and I give it to him on Monday morning. Could have been a little bit better. He was very, very rough on me. But I would say that he made it so interesting. If I can't explain, he made stuttering to be the most interesting condition I could imagine. The paradoxes, the more you try to stutter, the less you do. The more you try to hide it, the more you stutter. The notion of paradoxical assignments that, by the way, if you listen to my my YouTube channel, we have a series called Coffee with Vivian and Sarah, and we chat and talk about stuff. We didn't post it yet. We just had this conversation this week, but the whole conversation is about paradoxical intention as part of therapy. And so he introduced me to the whole idea of paradoxical intention and how that exaggeration and humor can be a part of change. He started every staff meeting with a joke. It was usually a stuttering joke. So it was fun. It was fun working with him. And I have really wonderful memories of all of it.
I think his analogy of the iceberg, of the stuttering iceberg, is just fantastic. And they say that that 80% of results come from 20% of actions, and etc. etc. But I think that's a really good analogy. Okay, does anyone have any final finishing questions or comments for Vivian? All right. Vivian, on behalf of everyone here, I would like to say thank you for giving us your time and sharing your knowledge, experiences, and advice. How can people contact you and learn more about arts and learn arts?
Yeah, first of all, I want to thank all of you for your thoughtful questions. I really enjoyed them. So thank you for the lively conversation today. They were really, really excellent questions, and I enjoyed it. If you want to learn a little more about arts, there's two places you can go to. One is the Sisskin Stuttering Center website. That's sisskinstutteringcenter.com. And Open Stutter, which is our YouTube channel, is another place to learn a little bit about it. We have resources and articles listed on the website. So if you go to Resources for All on one of the tabs, you'll find podcasts where you can learn about it. You'll find some articles, published research articles. You'll find a book chapter, and other little tidbits of things in order to get to know arts a little bit better.
Okay, so thank you for that. It's a message from Leonard. Thank you so much, Vivian, for a wonderful presentation, and thank you, Sam, for putting this together. Lots of fascinating ideas shared. Okay, so we'll just bring this to an end, and everyone, hope you enjoy the rest of your day, and yeah, this is the time where where I want to say where I want to say something witty, but I can't think of anything. So everyone, just everyone enjoys the day. All the best.
Okay, thank you.
Bye.
Bye-bye.
Thank you very much.
Bye.
Great presentation.